I am so excited to have Katrina here today. She is a stage 3 inflammatory breast cancer survivor. She's amazing. We've connected here on social media, and she is willing to be a part of Learn Look Locate as a spokesperson to get the education out there on this very rare yet aggressive form of breast cancer. And she has continued to educate me on the specifics of this disease, this part of this disease of breast cancer. So I'm honored to have her here today to share with you more about her experience with being diagnosed with inflammatory breast cancer and her passion to help people understand this particular type. So Katrina, can you tell us a little bit about yourself, kind of why you want to do this and what you want to do with your passion towards what happened?
Yeah, my name's Katrina. I live in North Carolina. I am 45 years old. I was diagnosed when I was 42 years old. So I'm currently 3 years cancer free. It's very exciting. And when you reached out to me about being a spokesperson for this, I thought, this is what I've been looking for. It's another way to be able to get my voice out there so people hear my story about inflammatory breast cancer. Now, throughout this interview, if I refer to it as IBC, that's what I'm talking about, just so everybody knows it's
Yes.
inflammatory. Um, I had heard of IBC before, and I was so glad that I did because then I wouldn't have gone home and Googled all this stuff and seen all of the non-updated information that's out there about IBC. So the reason I want to do this is to put this out there so women are familiar with this type of breast cancer because it is so aggressive. Even though it's rare, it's aggressive and it's one that we need to watch and really look at ourselves to see if there's any changes in our bodies or anything to get to our doctors to make sure that that's not what's going on.
What changes did you see, Katrina? And do you have any family
Um,
history? That's the big $1 million
we
question.
at the time I had no family history of breast cancer. I will say that after I was diagnosed, as soon as they told me I was cancer free after my treatments, my mom was diagnosed with breast cancer as well, but a completely different kind. She had a lump in her breast and she had triple negative breast cancer. Mine, of course, was inflammatory, and mine was HER2 positive and ER/PR negative. So we had two totally different kinds that we were negative for, with genetic testing. So none of that was there. So it was just a random thing that hit us both when she was 80 and I was 42. So um yeah, the signs that I saw, my story, it says I was in the shower. My story always starts the same way. I was in the shower. And when I went to rub the soap across the upper part of my chest into my underarm, I hit a hard area over here. It was like a pulled tight muscle. And the soap flopped out of my hand because it was so hard. And I did not expect that. So I was just sort of feeling around in there and it was tender and it hurt, and I thought that I had must have pulled a muscle swimming or something because we have a pool, but that's not what it was. When I got out of the shower, I looked at myself in the mirror and I could tell that my left breast was slightly larger than my right breast, and very quickly, my breast started getting harder and harder and harder, that whatever was going on over there, the cancer starting, I guess, was spreading and I could feel it. I mean, my breast was getting harder. It was starting to turn pink and then eventually it was getting red. So, yeah, it was moving very quickly. And like I said, I had heard of IBC before, so I'm thinking, I hope that's not what's going on. I hope this isn't what I have. But shortly after that, I had already had a mammogram scheduled, so I thought I'll just ask them when I go. Let's see what's going on. They'll be able to tell me. And the technician took one look at me and said, I can't do your mammogram. There's definitely something going on here. And so she ran and got the doctor. And the doctor said, "Yeah, I think we need to take a closer look at this. I don't think there's anything seriously wrong, but I would like for you to get an ultrasound done and a 3D mammogram." And I was going like the next day to get that done. I mean, it was pretty quick. So, yeah, they sent me in for that mammogram, the 3D mammogram, and my breast tissue by that time, this was 2 weeks later since the initial feeling in my underarm. My breast tissue at that so hardened that the MRI machine could not work on me. It kept sending us an error signal because it could not get a reading. It couldn't compress me enough. And it hurt so bad because it was so inflamed and everything. It was terrible. But they finally got the machine to work. The radiologist looked at him and he said he didn't see anything on there, but he wanted me to have an ultrasound. So I had the ultrasound done and he said he didn't see anything on there, but he thought I had inflammatory breast cancer. Um, so that
What
was it. That's how this
what
whole
were
thing
you
started.
what were you thinking all this time? What was going through
I
your
I
mind?
I kind of went into, I don't even know if I want to call it shock, but when he said that, it was like that video that I had watched years before that about inflammatory breast cancer came right back into my mind, and it was like, if this is what I have, I can't believe it. I'm going to die if this is what I have, because that's all I knew about it, was that it was aggressive and that you got to catch it fast or you're going to die, you know. And so I was scared, but I was trying not to overreact because I thought, who does that? What kind of radiologist sits there and tells you that without there being a biopsy or anything? Well, the next thing I know, I'm getting calls to go have a biopsy done. And so we got that set up. Within a week, I was getting a surgical biopsy done. And they told me right there in recovery from my surgery that I had cancer. So, and I had a reaction to it that I was, looking back on it, I was surprised that I reacted the way that I did because I felt relief in a sense because it was almost like I knew somehow, I don't, the back of my mind, maybe because I was so aware from that inflammatory breast cancer video that I had seen. It was almost like I knew it was coming for me or something. And so the relief was like, all right, let's get this over with. Let's do it, get through it. You know, it was like the worry was kind of gone then. It your brain just does strange things when you're in traumatic situations like that. And so
Almost like
that's really what I was dealing
the
with.
waiting, not knowing, and then the
Yeah.
knowing. Yeah.
Yeah. Not knowing what was going on was hard. But then finding out, it was like, okay. And I remember my doctor saying to me, we're gonna find out what kind this is, and we're gonna kill it. Meaning whether it was HER2 positive or triple negative or whatever, you know. So, um, and I lay there, half awake, coming out of anesthesia, and I said, well, God, gonna take care of me. Because my faith is important to me. And the doctor said, yes, and we're all going to take care of you. And I said, what do I tell my daughter? Because my daughter was 6 at the time. And I thought, how do I tell my 6-year-old daughter that I have this really terrible type of breast cancer? How is she going to get through this? And my daughter, we know now, is on the autism spectrum. So we were dealing at that time just with her being who she is, but not knowing why she seemed different than a lot of kids. But anyway, she handled it like a champ. That little girl was my strength throughout this whole thing. She was absolutely amazing. So, yeah.
So let's talk about the symptoms, because when you were in the shower and
Hmm.
you, I never did a self breast check, so
Yeah.
I never even. It's interesting, like that you would feel that, and
Yeah.
that at least you had the background of that video, and
Hmm.
understanding that this breast cancer. Tell me if I'm correct in this, that it does not show up at all as a lump or a bump.
No,
Is that?
It can be a lump, but, that's even more rare to have it show up as a lump. They describe it as like a spider web type cancer or,
In the
more of a
blood?
yeah, or more of like a plastic type cancer that can spread easily through your body. And what it does is it attacks the dermal lymphatic system under your skin. So once it gets into that system, I mean, it can just travel.
Wow.
Think about when you get a shot or something, that's going into the dermal lymphatic system. That's how that travels through your body. So that's where this IBC goes, and it's like a subway system through your entire body.
Yeah.
Um, yeah, it's scary, and it's like I said, it's very aggressive. They did an ultrasound on my um, axillary lymph nodes in my underarm, and they said everything looked fine there. Of course, they couldn't 100% say that they didn't have cancer in them at the time, but they weren't swollen. Everything looked fine on that ultrasound. Now, when I had another scan 3 weeks after that, they had counted that it was on the PET scan that it was in 8 lymph nodes. So it was all through here, within 3 weeks. So yeah, it was really, really cooking. And even my oncologist office said when they got the results from the lab, they had put a note on the lab results saying that this cancer is wild. That's how they described it, you know. So I mean, they were watching it. They were from the lab on, however they look at it under a microscope or whatever. But to say your cancer is wild, I mean, they were really concerned, and I was saying we want to plan a trip really quick to go away before I start treatment so that my daughter can have a good time because it's going to be a while before things are back to normal. And they said, if you're going on a trip, you're going this weekend because we are starting your chemo on Monday. I mean, and it was like, if you're going to do something, you've got to go now. You're not waiting any longer. So
I
yeah.
think, let me ask you a question. If you were in the shower and you felt this and you blew it off, did you talk
Yeah.
to did you talk to them about that? This is why it's so important what you're doing, because if women
Yeah.
see anything similar to what you're talking about,
Hmm. Yeah. I haven't talked to them about that, but I have thought about that for sure. Like, what I don't know where I would be if I had waited. And I would have. If honestly, if I didn't have that mammogram scheduled
you would have blown it
already, I mean, I was due for that yearly mammogram. So I probably would have waited until I really started seeing a lot more severe physical changes. Because at the time when I went in for the mammogram, my breast tissue was just hardened and my breast was slightly pink.
so you were like,
So,
whatever, no
yeah,
big deal.
but it hurt. There was definitely soreness and tenderness there. I keep touching that same spot as I'm talking
Yeah,
to you. But
yeah.
yeah, I always tell women now and men, tell everybody when you're doing your self breast exam, whether you do it in the shower or laying down or whatever, also add to that looking at yourself. Look at yourself in the mirror and see if you notice a physical change. Really get to know your body, know how your clothes fit, how your bra fits. My bra didn't fit on that side anymore, so it was obviously changing and something was going on. A lot of times people think they have mastitis, and the doctors often will think that that's the case as well. And so, we're given an antibiotic and it's not doing anything. So, meanwhile, the cancer's just growing in there, rapidly.
Mm-mm-mm.
So, yeah, I encourage everyone, like I said, take a look at yourself, really get to know your body. If you see the slightest change, go to your doctor, and you have to speak up for yourself. You have to be an advocate for yourself. Um, and if you feel something in the pit of your stomach, if you just kind of feel like, I just know, really check that out. Listen to your body because nobody knows your body like you do.
Mhm. I mean, and also your age, I got diagnosed older. And so women in their 30s, 20s, 40s, they're not, I mean, breast cancer is like the last thing I would imagine that was on your mind in your life that you're living. You're just living your life.
Right.
And what I really want to stress on is the hardness of the
Hmm.
skin. You're making me want to touch because, I
Yeah.
was walking around with a walnut-sized tumor here, can't see
Right.
me. And I never did self breast exam. So here I am. I had something that I could actually feel and touch and
Hmm.
never did. And
Right.
so if just went in the shower and you're feeling this hardness of the skin, did the doctor explain to you why is the skin getting hard? Is the blood just, forming together? Do we know this?
Yeah, no, the doctor didn't say anything about that. The
Okay.
doctor, was my gynecologist, and that's where the mammogram is, where I would get my mammograms done at her office. And
Okay.
so when she looked at me, she said, "Yeah, I mean, there's definitely some hardness going on in here. It might be an infection. I don't think it's anything to worry about, but I would like for you,
Okay.
the 3D mammogram and the ultrasound." So, I mean, I had those done, and when she actually called me personally and said, I wanted to check and see how you're doing. And this was several weeks later. And I said, I have cancer. She didn't even know yet. She was shocked. I said, did you see anything that you thought would make you think this is cancer? And she said, no, I didn't. See, and that to me is just a testament of how little,
Yes.
how few doctors actually know about inflammatory. And I'm
And
not putting the medical community at all by saying that, because it is so rare. It is one of those things that I think, like my radiologist, you just have to have an eye for something like that. But I think it definitely opened up her eyes.
mm,
I need to be more cautious about this when I see it in people, because, she's an OBGYN. So a lot of times it is mastitis that women are in there with very similar symptoms, redness and soreness, and it can get much worse. I mean, thankfully mine never got to the point where I had, they call it peau d'orange or something like that. I don't know how to pronounce it correctly, but the skin of your breast will actually look like an orange peel. It gets so red and so thick, it starts, you see all this dimpling all around it. And mine never got that way.
okay.
In fact, as soon as they started treatment, I had my first chemo and immunotherapy. I mean, within days, I could feel things softening up,
Mm.
and even the doctors were just like, it's melting away, it's just melting away. And that is kind of one of, if there's anything cool about IBC, one of the cool things about it is you actually see the change happening, you know what I mean? Because here I'm looking at my swollen, painful, thickened red breast, and
Run
it's
away.
kind of back down to normal, right before my eyes.
You didn't
So
get a double mastectomy.
I had, well, I had chemotherapy and chemotherapy first, and then I had my mastectomy on the left side. I then had radiation, and then I had reconstruction surgery, but I had the right side hollowed out. So all of the breast tissue was taken out of the other side. So technically, yes, it was double mastectomy. But they filled it right back in with fat. I had a deep flap. Actually, I had a hybrid deep flap done, which is partial implants and partial fat. So
It's interesting. Haven't
yes,
heard
it
of
is.
this one yet. Yeah.
Yes.
Yeah.
So I had that done, and they tested the tissue from my right breast, and it did show atypical hyperplasia, which means it would have come back.
I had
I
that
mean,
too. Yeah.
so
Oh my.
they they said it made my risk of recurrence like way down, by removing that tissue. But had
Okay.
they left, I mean, it was like increased my risk of recurrence by 30% or something. So I was so glad that I had that done. I had that surgery done down in New Orleans at
Okay.
Board of Breast Surgery. And the reason we decided to do hybrid was because I didn't have enough tissue to make me feel like I wanted to feel. I wanted to at least have the same size breast that I had before. And so he said, yeah, I can get you maybe 60% of the way, but we have this other option. And I said, I don't know if I want implants. I heard that's bad after radiation. He said, just straight on implants put in, your skin can change and things like that. So it's not the best option. But this way, when they do the hybrid flap, the implant tuck so far down in there, you don't even feel them. I don't even know that I have that. With the fat tissue that's there, it feels like my regular breasts again.
So
So
happy to hear that. That's a great story that,
yeah,
that really worked well for you. And it sounds like you had some really advanced doctors. I mean,
yeah,
that's the one thing I really stress is, I was not offered any of the deep flap hybrid, I didn't know anything. I didn't even know like aesthetic flap closure was an option. It was
yeah,
just whatever. So it's really nice to hear that you had that kind of treatment
yeah,
and advancement and that you're happy and
yeah.
all of that. I have a question for you. What did they biopsy? Just your skin?
No, they did a 1-inch incision on the side of my breast, and they went in fairly deep and took out tissue sample. So it was from the skin in, I think, an inch or 2 inches they went in. And now
Interesting.
that is not necessarily typically how IBC is diagnosed. IBC can be diagnosed with a mammogram because it does show up on a breast mammogram.
Right.
They can see the webbing of the cancer,
Like,
the they do call a tumor on there. They can see the webbing of it on an MRI. And they will also do a lot of times just a punch biopsy.
mhm.
But because my doctor wanted to get this done fast, she just said, I'm just going in there and I'm taking the sample out that I know that they can read and we'll do it fast. Cause I mean, they did it the same day. They read it right there at the hospital. So there
I
was
mean,
no wait.
I think time is of the essence with these
Hmm.
types of symptoms. And so we
Yeah.
did Instagram live with another survivor who had
Hmm.
the enlargement of her breasts, so really seeing the extreme difference and being aware. And I think anyone
Right.
who's listening to this really, and don't be afraid to push because we both
Hmm.
know there's a lot of survivors all over social media that have been dismissed. And
Yes.
thank goodness you were not dismissed, Katrina,
I that absolutely. And I'm in a location where I have really great doctors, and I have my oncologist is one of the top oncologists in the state. I
Wow,
mean, he's absolutely amazing. And, I've been really fortunate, really blessed to be able to have such great medical care here.
wonderful. I mean, I think the biggest issue that I see between inflammatory and Paget's disease is that it's just very unheard of, not talked about. Now, we
Hmm.
do have people that show a picture of an orange, like it could look like this and all of that.
Yeah.
But to your story, that was not your symptom, and that we need to make people realize your
Hmm.
initial aha moment was a hardening.
Right. Right. And it was definitely up where the tail of the breast tissue goes, up by your underarm. And it scared me because, like I said, the soap popped out of my hand. That's how hard it was. And I'm not just talking about like it feels a little tender. I mean, it was like brick in there. It was rock hard. So, and that was essentially within probably a couple of days that it must have gotten like that because I hadn't noticed it the day before, you
Okay,
know.
okay.
So
That's
it comes on pretty quick. And you know, it was over the course of those 2 weeks after I felt that and I was waiting for that mammogram, um, like I said, I noticed that my breast was starting to get larger on that side, and then it was getting pink, so those symptoms
not
were coming pretty quick.
good. Okay.
It was probably about 3 weeks or so after that that I started treatment. And by that time, it looked like a tomato. So yeah, it was it moves really fast, and it's I don't say that to scare people,
Okay.
um, that anytime your breast is red, don't be scared and think, "I have inflammatory breast cancer," because there are a lot of things it could be.
Yes.
However, you want to make sure that that is ruled out because of
Yes.
all things you don't want it to be, that is the one thing, and, um, like, I remember saying to my husband at the time, when I had seen that video about inflammatory breast cancer years before, I said, "Did you know that there's this other kind of breast cancer?" And of course, he's like, "How would I know?" But
I
I
had
I
no
said,
idea.
kind is called inflammatory breast cancer, and I was like, "It's really bad, and it's not a tumor," and all of that stuff, and it's like that's the one that ended up coming for me. So, I mean, I just wish more people talked about it so that more women knew about it. But I think now with social media, we have the ability to put this out there so more people can be aware of all of these different things.
So with I just want to go back to I had a question about people, really making sure people recognize that when we did a live with Dr. Stacy Smith Foley, and she said that some doctors are not even aware. I think we need to touch on this because that breaks my heart that I have a big problem with the gynecologist just saying, because I think I have my
Yeah,
own story. I don't think we're empowered. I don't think
yeah,
they have time to say, look, there are other types of breast cancers. And
hmm
maybe you check in the blind spot areas, under here and back, all this. None of this breast health education is
yeah,
out there. That is why I started this. I could
right,
not believe. And so the
hmm
more I meet people like you and Xandra, who has pageants and got dismissed for 18 months because they thought it was a skin rash,
right,
we are the ones that having these open dialogues to get this out there, right, Katrina? So
yeah,
anyone watching, please know that, at least Katrina, if you hadn't seen that video, that's where I'm really like, there was a reason. I mean, what are the
yeah,
chances? Think about that for a second.
yeah.
Yeah,
I know.
very,
I thought about that. Like, that's why it was in my mind. And of all the different types of breast cancer, that's the one I knew about. And so when it hit, it was like,
you had some
okay,
knowledge.
let's
Yeah.
go, you know?
Yeah, and you took action. I'll be honest, I did this. My friends were kind of blown away. They're like, "Look at you! You're lining up your radiation and your surgery. What's you supposed to do?
Yeah,
This is serious. The word cancer is something we never want to hear, and we
right.
take action. And I think you said something earlier. Moving through it, and just processing it. I think from the emotional side, I
Yeah,
like to bring it to the forefront. Anyone that's newly diagnosed and in such a fear state,
yeah,
one thing that helped me, and I don't know if you went through this, Katrina, is I really dropped down to my knees with the
hmm
mortality head on. And,
yeah,
I went there, I think anyone but I will tell you, based on listening to you, and there are a lot of great treatments and a lot of great doctors, and breast cancer is getting a lot of attention and research. But what we're
hmm
trying to do here is get the education on the forefront, because
right,
we all think we're not going to get diagnosed, especially if you have no family history. But
right.
to 85%, which is just mind blowing to me, of
Yeah,
women diagnosed have no family history. So
right.
we need
I
to
know.
all
I
wake
tell
up.
people, in fact, I had a meeting today about a fundraiser that my daughter's school is doing for cancer, for the American Cancer Society. And I said, it's not a matter of if it's coming for you, but when it's coming for you or someone in your family. I mean, that's kind of the way to look at it. If
Oh,
your
wow.
entire been affected by some sort of cancer at this point,
Yeah,
consider yourself very lucky because, you
it's
know,
true.
it's there one way or another, it's coming. Um,
Well, I had a
yeah,
history of cancer in my family. My father died of lung cancer. My grandfather died of colon cancer, I never was genetic tested.
Yeah.
Crazy.
Hmm.
I mean, I have a family history of cancer, and I'm all about genetic testing, and it's just so sad. So let's talk about kind of your advocacy work, because it's just really amazing. And I think many of us get kind of tapped on the shoulder to take this further, because we can't just move on. We know too much.
Yeah.
So share with me what your vision is and what you're doing and how we're going to
Yeah.
work together.
Right. I know when I was going through treatment, I thought I just want this to be over and I want to move past it and I never want to think about cancer again. But it never let me go. And I got pretty depressed when I went through it, and actually a little bit afterwards I was still kind of depressed, and I thought, "You know what? I am just going to stand up to this beast and tell the world about it so that they know
Yes.
that
Yes.
power in coming forward, there's power in telling your story." I know there was a time when it was like we didn't even say breast cancer, but we have to be able to talk about this and share our stories and not be embarrassed or ashamed about what we went through. So for me, I started out, I completed the advocacy program through the IBC network. I did that, and that just basically gave me some education about IBC, so I could understand it a little bit more. And then I've been active in my community. Like I said, with my daughter's school this year, I'm helping to head up a Coaches versus Cancer fundraiser for her school, which is a big deal with the American Cancer Society. I'm working on writing a book, and
Nice.
it's taking forever because I thought it was so simple. You just sit down and write a book, but it's not.
Yeah.
um, and I'm actually trying to put a different spin on it than a lot of breast cancer books that are out there. I think anyone who writes a book about their story is phenomenal.
Mhm.
Um, this one I want to be a little bit different though, so I'm kind of writing it more like a novel. And the cancer actually is a character in the book. My brain is its own character in the book.
I like
Um,
that.
yeah,
That's
music really was a huge thing that helped me through because I had this really, really odd side effect from one of the chemo treatments. It made my ear whistle all the time. So I started listening to music to cover that up because I was about to go crazy. And I
yes.
heard so many different types of music that just blew me away. I mean, I had no idea what the world of music was like before that. And that really helped me get through. So I'm trying to be some sort of advocate for cancer within the music community. And then I am just in the very, very beginnings. I haven't really shared this one any yet, but I'm going public with it here, trying to start my own little foundation somehow to work to raise money for cancer research because I mean, it's just so
I
important.
I agree
And
with you.
I had seen something recently that said you can't look at what's ahead of you. You just have to go step by step. You can only turn around and see what's behind you. So, whatever you do, make sure when you turn around and see the steps that you've left behind that you're proud of what you've done.
Mhm.
And, you know, that really it's changed my life. Having cancer really changed my life, and I went through that traumatic experience for a reason so that I can turn around and say, "Look at the steps I've taken since then. I've come out stronger, I've come out more independent, I have put a positive spin on this,
Let's do that.
and just let me help anybody that is willing to listen, to get as much information as they can for
Yes.
this, and hopefully, it can save a life or 2 or millions. That
Oh,
would be,
absolutely.
you
Katrina,
know
what you've just shared here to the world, I mean, here at Learn, Look, Locate, I mean, I want to be global. I mean, there could be a woman in Italy or France or Greece or India that's listening
Yeah,
to this, and you have gotten them to wake up and realize it could be inflammatory breast cancer. And because it is such a quiet, not talked about, doesn't get nearly the attention as invasive ductal, which is like 92% of the,
right.
cancer, so yes, you are doing it, and it takes time, but we are here to help as a
Yeah.
platform. That's why I did this. I want to get these voices and your stories so that
Mhm.
other women are just feel more empowered. And like you said, once you finally knew, there is a sense of calm
Mhm.
that comes over us, and there
Right.
may be a reason why it all happens, because it is very rewarding to know that people are seeking you out and they want to
Yeah.
learn from you, and that not only did you go through such a traumatic time, but you have the mind took you to a positive place, and
Right.
it's important that anyone newly diagnosed with cancer, the mind can take you to a rabbit hole. And that's why, you know, Learn, Look, Locate is very colorful. Then I just want to share, I don't know if I've ever told you this. I did it this way because we're scared enough. And so I
Yeah.
want the brain to relax. And as women, I think we need to see things that are pretty because I think it helps us feel a little bit better because it's hard enough, right? So
Right.
I'm so excited that you want to get your voice out there. And, we are here to bring you, raise and lift. And when the book gets out, you got to let me know because
Yeah.
the link
Yeah.
out there so people can get it.
Mm-hmm. Yep.
Any last closing thoughts?
Um, have been in talks with Jamie at Test Those Breasts for her
Yeah.
podcast. So I'm going to be doing an interview with her as well and talking about some other more personal things that can happen in your life when you're going through cancer treatment too. So it's going to be tough, but we're going to talk about it. And I just don't want any woman that's out there going through any of this to ever feel alone. We always say with breast cancer, this is the club we never wanted to be in, but once you're in it, I mean, friendships and the women that you connect with and the men that we connect with. I mean, I know we tend to leave the guys out, but I mean, male breast
Oh,
cancer.
yeah. So, Katrina, if you could tell anyone who's watching this just a last closing thought, what would you like to say?
Um, I just want to say, try to make it a point the first of every month to give yourself a self breast exam. Really feel around in there as you can, and not just stop there with you know, touching, but looking at yourself. Take a minute to look at yourself in the mirror once a month and notice if there's any changes. Take a minute to see how your clothes are fitting, how your bra is fitting. If you think there's any type of change, see a doctor. IBC is sneaky. It is a sneaky, sneaky breast cancer. And once it starts growing, it grows quick. So, you know, don't feel like you're wasting a doctor's time. Don't feel like you're wasting your own time. Get it checked out because the best answer is they're going to test and find out that you don't have cancer. But if you do, you want to find out as soon as possible.
So, Katrina, part of your treatment was immunotherapy. I'm not aware of actually what it even is. And can you describe it and tell us what it did for you as far as your treatment?
Sure. I can't, since I'm not in the
No,
medical community,
right.
I can't explain it all that well, but I know that they gave it along with my chemotherapy. And I had HER2 positive breast cancer. So I received Herceptin and Perjeta were the two immunotherapy treatments that I got. And from what I understand, it kind of blocks the receptors on the cancer cells from
Ah,
being able to grow. So that way the cancer basically is dying from that. And it doesn't attack the healthy cells, it only attacks the cancer cells. So I would be dead though if I didn't have that because HER2 positive cancer is another aggressive type. And so here I had inflammatory breast cancer, which is extremely aggressive. And then I've got HER2 positive and estrogen progesterone negative, which meant it was also very aggressive. So I had those two strikes against me. But, you know, I could see where my breast was discolored from the cancer. And as they started giving me these treatments, I mean, within a few days into weeks, I could see my breast going back to normal. So I could actually, it was almost like I could physically see the cancer dying in front of me, which
Incredible.
was amazing. But yeah, immunotherapy, I think, is really on the forefront here of cancer treatments
Yes.
these days. It just, it's like a silver bullet. That Herceptin is like a silver bullet for this. And there is a movie about it that I encourage people to watch. It's called Living Proof, and it stars Harry Connick Jr. And it's about the
He's wonderful.
scientist, Dr. Dennis Slayman, who was just persistent in his research because he knew that this would work. And I mean, he got it to work. He came up with
I'm gonna
Herceptin,
watch
and
it. Wow.
thank God. It is an excellent, excellent movie. And it really portrays the story of the lab work and what goes into that. It's amazing.
It's nice that you call that out. We should really recognize the incredible treatments and the people that come up with all of this. I mean, I think they're such the angels behind the shadows that don't
Yeah.
get the call out that really need to. So this
Mhm.
is really interesting and great because I think immunotherapy, again, that's another topic that I mean, I can't stop. There's so much
Yeah.
education so that
There-
someone like you who understands and has a thirst for understanding a
mhm.
lot of the learn, look, locate doctors say, knowledge is power, and the best patient is an informed patient. So
Right.
I think we should really stress that as two survivors that, I mean, I obviously took it to the extreme, but I think really being empowered about, this, it's our life.
It
So
is. It is.
we have to take it into our hands
Mhm.
because we don't get a lot of time with these physicians either. So we really, understanding what's going on and how to be in survivorship too. I think we're both sort of navigating that as well, right?
Yeah. And I think too, a big part of cancer treatment should be mental health too. Eh, that's a huge one for me.
Yes.
I just wish somehow healthcare could be changed, that when somebody is getting told that they have cancer, that they're also told, okay, now we have a mental health professional that you can go talk
Oh,
to.
yes.
Um, so, that's a big one for me. And because of you, through Learn, Look, Locate, I found Immerman Angels. And so, I work with them now, and I haven't
Oh,
had any
yes. Happy to hear that.
cases yet, but I signed up with them to
Be a
help them.
mentor?
Because, yeah, to be a mentor, because I think that work is so needed. And
I had one.
I'm trying to spread the word. I tell my oncologist, my cancer doctors, all of them about it so that they know that these resources are out there, because they don't even know, a
Oh,
lot of,
yeah. And a lot of women don't. I did not want to be in a formal group. I just didn't want that. And so my cancer center offered Immerman Angels, and they pair you up with someone who's almost exact was the same cancer, even the same personal stuff that was going on with me. It was
right,
incredible. She has a daughter and all of that. And so, yes, to your point, that's why I push them and celebrate them. And I am actually going to do a post on this. The fact that you just said who thinks that when you get a breast cancer diagnosis, you should also have an immediate counseling appointment? And it's just not there. It's just like,
right,
it's our
right.
mental capacity to process this that is, it's the void of what's going on, and we need to talk about it. So I'm glad I didn't know that. I'm so glad. That makes me, because I talk about it often, and I don't think people truly understand they are complementary, worldwide, one-to-one. It's for cancer patients, previvors, and caregivers.
Right.
So
Yeah.
really, I'm so glad to hear that. But I have to run, but I'm again so grateful. Thank you,
Okay.
Katrina. For
Thank-
those watching, I hope you found this to be extremely informative and helpful. And we are honored to have you be part of this, Katrina.
Oh, thanks. I'm honored to be part of it. Thank you for asking me to come on board.
Absolutely.